Community.
Hello and welcome to the special edition COVID-19 Rogers television program dedicated to providing you and your family with information about resources and services available during this pandemic. My name is Carol Merton, and before I welcome our guests today, those of you who watch the program regularly know that I like to spend a few moments at the beginning to express my thanks. So I change up the message just so you don't get bored with hearing the same one, because COVID-19 changes all the time. So this is my message to you. So as we move through is one of the reopening of our province. We celebrate the lifting of some of the public health restrictions, and we continue to be hopeful that we can move towards phase 2 and phase 3 of that plan. Significant attention to the details required to keep the public and employees safe is very clear, and it's obvious in the various businesses and services that are reopening. They need our support to follow these instructions and directions as we keep working together to prevent the spread of COVID-19. I know for sure that I'm learning to look down often to the store floor to make sure I'm following the directional arrows correctly. I've been told if I'm going in the wrong direction. We know that this situation is fluid and it keeps changing as the number of COVID-19 cases continues to be monitored closely by public health. Without a doubt, we are all anxious to have our lives get back to normal, and we know that the new normal looks very different than it did a few months ago. We are anxious to move forward, and those on the front lines are weary. Thank you to all in our community who continue to provide the supports and services needed to our medical officer of health, the public health unit staff, and all of our frontline, essential, and community support services for their ongoing efforts to keep us safe. We will get through this together, and we will be stronger than ever. And on that note, I want to welcome my guest today, Sandra Chamberlain from Parker Home Healthcare, who's going to be telling us about medical equipment, the medical equipment vendors, suppliers, and the response to COVID-19. Sandra, thank you for joining me today.
Well, thank you, Carol. Thank you very much for having me.
My pleasure. I know in the past you and I have had great interviews, Rogers Studio, talking about new products and resources that you have. This is different for me, and I'm sure it's different for you as well.
Very much.
Yeah, but you have lots of information to share, and I'm very, there is always a need for medical equipment. But like everyone else, your business has been impacted by the restrictions. Can you explain first where you're located, and then, what have you done in response to the restrictions?
Okay, well, we are located in Owen Sound, 1545 16th Street East, right across from Heritage Place Mall in the East Court Plaza. We have been open throughout the entire process of COVID-19. We were deemed an essential service, but we are working with restricted numbers in the store and staff, just trying to keep everyone out of harm's way. What we're doing in the store, and it changes depending upon how busy we get. So in the beginning, of course, we weren't getting too many people coming in the store. It was just basic services, people who need supplies and that sort of thing. So we just practiced social distancing, made sure that we weren't staying too close to each other, and the store is large enough that certainly we can do that very easily. There is sanitizer at the cash. We make sure that we clean our POS machine regularly, we clean our front desk regularly, we clean the doorknobs and the automatic doorknobs so that people can be fairly confident that everything is clean and that they're not going to pick anything up. We even do the chairs, that sort of thing. So as we've been getting a little bit busier, and people are starting now to request things like measuring for bracing, measuring for stockings. And these are some of the products that we carry that really involve us being up close and personal. And this has been a challenge to try and accommodate people. We've tried a couple of different ways, and we're not happy with the way that some of those have been working because it's been a struggle for the client. So what we will do now is basically face mask and glove up to allow us to get close to people. And we make sure that whatever we're using in terms of a measuring tape is also sanitized at the end of each use. As we go forward and we get into larger equipment sales, larger medical equipment as the need arises, everything will be sanitized and cleaned. We have a steamer for cleaning the mastectomy bras and mastectomy clothing to make sure that nothing is passed along. The shoes are isolated if they're tried on, so that people are able to, be sure and confident that if they come in, they can try something on without any worry whatsoever. So those are some of the things that we're trying to maintain a little bit of a step ahead as people require different products.
Right. So you're describing that you offer specialized services, actually,
Yes.
mastectomy services, and the stockings. Can you talk a little bit more about what you mean by stockings?
The compression stockings. So basically, yes, we sell all strengths of compression stockings, but when you get into the higher strengths, you do need to take a measurement in order to get a correct product on someone's leg or arm. So we definitely need to get close to you. We need to take the measurements, and we need to protect both you and ourselves from any harm that way. So we're going to go. It hasn't been recommended that we do this, but this is what we're going to do as we go forward, is just to be masked and gloved to make sure we can do that and make sure you get what you need. I've heard stories of people having to wait months and months before they can get product just because of the COVID-19. So we want to make sure people get what they need.
Because for sure, in certain circumstances, getting the product is critical for the health and well-being of individuals.
Absolutely.
So you've been open throughout, but just modifying what services you can do and how you do it. Lots of cleaning. Are you finding that people are fearful of coming in?
Some are and some aren't. Some are very fearful of coming in, so they're very cautious, and there can be underlying health issues that are making them be that cautious. So we just respect the boundaries that they need. If some people are a little less worried about it, it just you go by what the client is really letting you know. As to whether or not you gown up or not.
Yeah. So you wear masks and gloves, and I know in a few minutes you're going to show us some items related to that. Do you want the clients or the patients or customers, I'm not sure what your official term is, but do you want them to wear a mask as well?
Again, if they're not wearing a mask, we just make sure that we do maintain that social distancing. As we get a little busier, and I'm finding that in the last 2 weeks, things have been getting a little bit more hectic. If I'm seeing more people in the store, then it is time to actually mask up, because you can't really do that social distancing. So we really gauge it by who's in the store and what's going on.
And often for people who need medical equipment, they don't come alone. Like they'll have others. So that makes it even more challenging than with numbers.
It can be, yes.
So are people booking appointments to come in and see you, or is it a combination of booked and off the street?
It is a combination of booked and off the street. A lot of people do call to see if they can come into the store. Some people, depending on what the need is. So if they're going to be here for a while, so for example, a compression hose would be definitely a good example of that. I am encouraging people to make an appointment because then I can control the situation a little bit better.
Yeah. So some appointments are definitely appropriate.
Yes.
So how are you addressing issues like the larger sized equipment, wheelchairs, walker assessments? How does that work now?
Okay. Well, we haven't really had a lot of walker assessments. We're not really going through that at this point in time. We have had some scooter assessments. With a scooter, what we're doing is we're sort of cleaning the equipment prior to the client trying it, and then, of course, cleaning it afterwards as well. The same can apply to the rollator assessments once they start up again. We have had some people who are just looking for rollators, so we usually clean things up after they go. But yeah, cleaning, as you said earlier, it just seems to be what we need to do on a regular basis and be very, very mindful of.
Now, in some agencies and organizations, more and more virtual assessments are being done. Virtual, rehabilitation or virtual intake is being done. Do you foresee that as part of your particular practice in the future, or how do you see it working, especially when we have to exchange information and signatures and all that good stuff?
That's a very tricky question. With us being a vendor, we're usually in the position of delivering the equipment. Certainly, we can provide assistance if you're doing a virtual assessment. I'm not really sure how that's going to work because, as you said, signatures are going to be needed. Mail, certainly. It's something that you would probably have to send something out by mail in order to get a signature. That's about the only option we have right at the moment until we do open things up again. But we definitely are in a situation of actually having to go into the client's home to deliver and set up. And we are faced with that, certainly with our rental equipment as well as any future assessments.
So when you go into the homes, then you would continue with wearing your masks and all that because you have to be protected, right?
Absolutely, yes.
You're in their environment now.
Yes.
And do you ask for a limit? I mean, if you go into a home, it could be many people in a home environment. How do you control the numbers?
We do ask prior to delivery if anyone has been ill, if anybody has been out of the country, the standard questions, just to make sure that there isn't a potential threat for our staff going into the homes. We make sure that we have our Cavicide with us so that we can certainly wipe down the equipment prior to it going into the home, and make sure that we've got sanitizer to make sure that we're not bringing anything out of the home as well. It's we haven't really experienced a lot of people in any one particular home. Most of the time, it's just one or two individuals that are in the home.
Yeah. So what happens when people have, for example, a piece of equipment that's broken down? I mean, I know you do repairs, right?
We do. Yeah.
So how do you deal with them wanting to bring equipment from a home into your environment?
And that's fine. We can take the equipment in, we bring it in, and we clean it down so that anything that is on the equipment can be removed. Then we can start working on it. And depending on the situation, what we're working on, we can be gloved or ungloved, but we do a cleaning once it's brought into the environment, and then we clean it prior to it going back out again.
So for your cleaning, you mentioned Cavicide. I mean, so you use, very specific type of cleaning materials that individuals may or may not have in their own home environment, but you as a vendor, you use the heavy duty stuff is really what I'm saying.
It cleans very, very well. With our rental equipment, we make sure that product is brought into the store. We accept it back from the client if they're bringing it back in again. We do an initial spray down of the equipment with a Lysol-based product, and then it goes into our cleaning area that really you're hosed down hot water and soap, that good old-fashioned hot water and soap, left to dry, and then it's wiped down with Cavicide as well again. So, you're killing anything that you can possibly kill on the surfaces. Mm-hmm.
Yeah. All of this sounds like it takes time. Do you find that, that it's more challenging with the time commitment now?
Yeah, very much.
Yeah. And do you find that wearing a mask is tiring in itself?
It is, and all the same problems that everybody else is experiencing. Your glasses fog up and you can't see. The other side of the coin is you can't hear people very well when they're wearing a mask. And of course, some of the people who are coming into the store are a little bit older. They may not project very well. And we also have our screen up now, so that's just another layer to try and get through. So listening is very important these days. To really hear what people are trying to say.
Yeah, the communication can be a little bit, definitely more challenging actually, because there is that additional barrier. And you're right, you serve a variety of ages and people in different states of health.
Yes,
for sure.
Yeah.
So tell me about show and tell. This is the show and tell part now. I know you always bring things to demonstrate, so I'm just wondering what you have to demonstrate for us today.
Well, basically, I just wanted to say that we do have PPE product. I know people are looking for PPE, personal protective equipment. It's been very, very difficult to get. We've been trying to keep the costs down, of course, because things are coming in special order from places like China. People are trying to set up manufacturing sites here in Canada that will produce PPE product. We've had some of our wheelchair manufacturing companies who have sort of brought in and started to develop some product. So one of those products I do have to show you. This is a non-medical mask. Yes.
So that's basically we call that a face covering, right?
Face covering, exactly, or non-medical. And it's been sewn by one of our suppliers out west. So it's a Canadian product. Has the full ear holders, and there's a little bit of forming around the nose. And these actually help a little bit with the fogging up of the glasses. They're actually constructed in such a way that they sit under the glasses a little bit better than some of the paper products like this one does. So this is a standard surgical mask, which we do. And they have the little plastic in the nose that you can form around, but they tend to ride up for whatever reason. So.
Yeah. I'm wondering if I could take you back to the very first one you showed, if you can hold that one back up again. So does it have 2 layers?
It does. And there is an opening in this. I don't know if you can see that very well.
Yes.
You can put a filter in this. So if you wanted a little bit of added protection, you can put a filter in between so that you are not breathing through any smaller particulate. So it's a little added protection, but you can, actually, I've got that upside down, sorry. That's a little added protection for you if you feel that you need that. And a lot of your choices in these things are actually how much protection you feel that you need. Some people feel they're okay, they've got a strong enough immune system and they're not too concerned, they just want a little bit of protection. Other people want an N95 mask and that's all that they'll accept. So it's totally personal.
Yeah, so certainly having the double layer is encouraged for sure.
Yes.
Yeah, and then you're indicating there's a filter. Is there a special, do you sell separate filters? I mean, I've heard so many different things that people use, but do you carry filters?
We don't actually, and we've just gotten these in, so it's all fairly new to us, but just a small filtered layer that you can cut and fit in there, I think is really all you need. But no, we don't sell the filters separately.
Yeah, excellent. So that's available. That's Canadian made, and you carry them now in your store.
We do.
do they come in different sizes, or is it one size fit all and you just snug up the ear?
They are, yeah, they are one size fit all. They are an adult mask. They're not a children's mask. So I don't have any children's masks in.
Yeah.
But yes, they are an adult mask.
So the second mask you showed, if you don't mind pulling that back up, so that's definitely a face mask then.
Yes, this is a surgical mask. This is often what you would see at the hospital or in the doctor's office. The doctor would wear something like this if he was doing some sort of a procedure. You have the little plastic piece at the top that goes around, forms around your nose, and these ear loops. And you've got layers in here, and it opens right up so that you can get it in underneath your chin.
Yeah.
So and this is what most people use is this type of surgical mask.
Yeah. So you've got a supply of those as well.
Yes, we do.
Yeah.
Yes.
So are you finding the demand is definitely growing? Now people know you've got the supply.
Well, it definitely is. People have been looking for stock for a long time, and we've been scrambling trying to get stock in. So we've had 2 or 3 orders of these masks, just trying to meet the demand that people are definitely looking for something. And of course, too, the government hasn't really come out and said they're going to mandate masks, but they are strongly suggesting that, you do wear something. And people are wearing all sorts of things. I've seen all sorts of, even a scarf, is something to cover your nose and your mouth.
Yeah, yeah. So certainly in your environment, it actually is helpful if people will wear something coming into the store because it protects you.
Sure.
And you wear something to protect them.
Yes.
Yeah. So it actually works both ways.
Yeah.
Yeah, for sure. I wasn't sure if you had anything else you wanted to demonstrate in your little treasure.
We also have face shields now. So I know we've had people looking for face shields. A lot of hairdressers, if they are able to open again, I believe they are going to be mandated to wear the face shield. But some people want this as well. We have a small supply of these. If you're in a situation where you do feel that you would like to have a face shield for personal or professional use. So that is available as well.
So I just needed to understand, just the way it's showing, can you see through it? Is it, or is it just an opaque kind of plastic?
It is an opaque kind of plastic, yes.
Yeah. So for a person to actually wear that, how would they position it on themselves?
It comes with a little Velcro strap. So you place the strap through these holes, and it goes around your head and just Velcros together.
Yeah. And so there are some, we're all anxiously waiting for the hairdressers to get back.
We are, yes.
and they certainly are not part of the first wave, but for them to be able to, they will be expected to wear the face shields because they are definitely right in your face when they have to do a lot of what they do. Yeah. So you now carry some of those as well.
Yes.
Was it difficult to find those face shields like it was the others?
Yeah, it wasn't so much difficult to find the face shields. It was difficult to find them at a decent price. There's a lot of very high-priced product out there. Partially because some people are going out on a limb and they're buying a container from China and bringing things in. So yes, you can get some pretty cheap product, but for suppliers like myself who are only buying a few things at a time to satisfy a local area, it's sometimes too expensive to purchase those items. So just finding something that is made at a decent price. They're still higher priced than they used to be, but just trying to maintain a decent price for retail.
Yeah, and even knowing how much to order in. I mean, if you get too much, you have to put in storage, right?
You do, yeah.
And if you don't have enough, then it's a matter of reordering. So it sounds like a very delicate balance between how much and how to get. Yeah. Have you been surprised at some of the things that you've seen in this COVID-19 in relation to your business? And what do you anticipate going forward?
Well, it's very uncharted territory. So I can't say that I have seen anything unusual that is specific, because everything is unusual right at the moment. People are trying to cope with new circumstances, and you really do have to keep an open mind, because people will deal with things as they feel safe to do. I've seen people completely covered as they walk around the streets, and I've seen people not worried about it at all. So I'm just, you really just have to accept what people are wanting to do. So I haven't really seen anything that I would say is outlandishly strange, because everything is strange.
Yeah.
Going forward, I hope we can, open up quickly and get things close to normal. I know we're not going to go back to normal. Things are going to be different these days. We're going to have to be flexible and go with flow. We don't have much other choice. So I'm hoping that the faster we can get opened up right across the board, the better it's going to be for everybody. And we'll just keep on trying to maintain that healthy atmosphere, keep people as healthy as possible. And we've been very, very lucky in this area. We have not had to face what some other areas have. So we're very good, but I think we can continue to maintain everyone's health.
Yeah, and certainly keep the curve as flat as possible, for sure, by taking all precautions that are necessary. So we have about a minute left in the program. Is there anything else you'd like to share that I haven't asked you?
Well, not that I can think of. We're playing it minute by minute. We really are. It's as things come up, we go, okay, fine. That's the way it's going to be now. We're going to go in this direction, and we just have to play it by ear all the time.
And sounds like you're doing an amazing job of being able to pivot your business model to meet the needs of the people out there who need the medical equipment. Yeah. Thank you, Sandra, for joining me on the program. And thank you to our viewing audience for joining me to learn more about services and programs available to you and to your family. Please take care, stay safe, and care for each other. Thank you.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Are you the type who would keep going or stop? It's not easy to stop when you have an addiction. Legalizing cannabis won't stop addiction. It trivializes its consumption. Let's be vigilant. If you need help, visit portage.ca.